Welcome to the selfgrowth.com show. My name is David Riklan, and I'm the founder of selfgrowth.com. Today, we'll be discussing how to optimize a full night's deep sleep. To help us understand this topic, I'm excited to interview Dr. William Pawluk. Make sure to listen closely. We're going to be sharing a lot of information today, and I know that sleep is an important issue for a lot of people. Before we get started, I just want to take a couple of minutes and share some information about Dr. Pawluk. Dr. Pawluk is an MD, MSc, and a holistic doctor in Baltimore. He had previous academic positions at Johns Hopkins and the University of Maryland. His training includes acupuncture, homeopathy, hypnosis, sound, light, meditation, and body work. He's an authority on pulsed electromagnetic field, or PEMF therapy, and we'll be talking about that, and has worked with a large variety of magnetic field therapies for over 30 years. He's been interviewed on well over 50 radio, podcasts, magazine, and TV shows combined, and was a co-host of a 2-hour holistic health radio show in Baltimore for 10 years. And before we jump in, I want to give everybody a website to jot down because there's a lot more information about sleep that they have on their website. I'm going to give you a website to go to. It's selfgrowth.com/sleep.html. So that's selfgrowth.com/sleep.html. At this point, Dr. Pawluk, welcome to our show.
Well, thank you very much. I just want to add that I'm also an author of a book, which is behind me here. It's called Power Tools for Health. That's a distillation of a lot of that information that we discussed, about 30 years of working with PEMFs. And one of the beautiful functions of help with PEMFs is sleep. That's why we're doing this discussion.
Sure. And sleep, as you know, is a major issue for many people worldwide. In the United States, it's an overwhelming issue for many people. So let's jump in. So what are the problems caused by and the results of this chronic poor sleep that we're all getting?
Well, the problem is caused by, breaking that down, what causes poor sleep and what does poor sleep cause? So the two are really very much related. They're correlated. So one absolutely amplifies any problems with the other. Now, the causes of poor sleep usually have to do with aging is one of the most common causes. Any kinds of physical problems. I think anybody who has to get up at night to go to the bathroom is going to have a problem with getting back to sleep. Most people do, at least to some extent.
Right.
Some people don't, but many people do. So that's a cause. At least it's not a cause of not sleeping through the night. It's a cause of interrupted sleep, and depending on when it happens. And if it happens multiple times during the night, then that's even worse.
Right.
Chronic poor sleep can also be caused by what we call hygiene problems. Having your cell phone by your bed, having a shiny clock radio, having any other lights, night lights in the room, especially blue lights.
Right.
So red lights are better, blue lights are not so good. Not pulling the shades. So if you have too much light, then what happens is that you don't shut down or cause melatonin to be released. So light decreases the production of melatonin, and melatonin is produced deep in the night.
Right. So
melatonin is necessary to help you with good sleep as well. And even if you have all those things happening, if you are one of these people who typically has a melatonin production problem anyway, then that's going to contribute to the sleep problem. Watching TV too late at night before you go to sleep is all flickering lights. And what do flickering lights do? They cause all the brain waves to wake up and decrease the production of melatonin. Right? So that's a major cause, is watching TV, having too much stimulation, audio-visual stimulation before you actually go to sleep. That's part of sleep hygiene. So we don't want to talk about sleep hygiene too much because there's a ton of information on the internet about sleep hygiene and what you need to do. If you don't control that, then you're basically fighting an uphill battle.
That makes sense. Yep.
Right? So you got to deal with sleep hygiene. Then again, physical illness is a major cause. Coffee can be a major cause for a lot of people. There are a lot of people who will drink a cup of coffee before they go to bed and sleep well all night long. They're sort of coffee resistant.
Right.
But I don't know if most people know what we call the half-life of coffee is. The half-life of something means how long does it take for that to be eliminated out of the body. not only in terms of the chemical itself being excreted or pushed out of the kidneys or the liver or into the gut, but also the effects on the body. So the half-life of coffee on average is 12 hours.
That's a long time.
So if you drink a cup of coffee in the morning at 8 o'clock, then half of that coffee is still in your body at 8 p.m. at night.
Wow. Okay. So
So
it's
if you go to bed
impacting.
at 10 or 11 or 12, you still have a significant amount of coffee in your system, particularly as it affects the brain. So it's already chemically, it's acting on the brain, suppressing adenosine primarily. So we drink coffee so that we are not tired, but one of the effects of coffee is not to stimulate you, but to suppress something called adenosine. Adenosine and caffeine kind of go to the same receptors in the brain. So coffee is a major culprit. And I don't mean just coffee, caffeine.
Right.
Right. So decaffeinated would be okay, even if you drink green tea. But if you're drinking 8 cups a day of green tea, you're getting a lot of caffeine unless you're drinking decaffeinated green tea.
Right.
Right. So caffeine is, again, a major culprit. Another culprit that people often use to help them get to sleep is alcohol. So what happens with alcohol is it suppresses a brain function temporarily, but then the body detoxes that, has to detox it. As you recover from the alcohol, the effects of sedating you from alcohol, you get a rebound effect. And that rebound typically happens 3 to 4 hours after you have your last drink. So if you're having a drink of wine, a glass of wine just before you go to bed, assuming you don't have more than that, if you have 4 or 5 glasses during the evening, which is not uncommon, then you're going to have even more of a problem.
Right.
So even 1 glass of wine is enough to cause that rebound problem about 2 or 3 in the morning. And then it's hard to get back to sleep. So those are some of the common causes of poor sleep.
All right, that makes sense. And a lot of them we've heard about and people know about caffeine for sure. What's interesting, what always struck me as interesting about the alcohol is people tend to think that alcohol helps them get to sleep. But as you're pointing out, even if it helps you get to sleep, you're still going to wake up because your body's going to cycle through it. And the sleep probably isn't as effective as non-alcoholic sleep.
That's absolutely correct. You might go asleep deeper temporarily. But again, there's this rebound problem.
Right. So obviously, a lot of issues, people are having difficulty sleep. What impact does it have on us physically, mentally, this lack of sleep, and especially this chronic lack of sleep? What is it doing to us?
Well, I think we all know what happens when we have a really bad night. If you have a baby, so probably the people in the worst situation of all are women with new babies, families with new babies, mothers particularly.
Yeah.
Fathers are co-supporting the baby throughout the night, then they're both sleep deprived.
Right.
Right. So that goes on for months until finally the babies have a full night of sleep. And then there are always interruptions as well. Anyway, if you have pets or animals that are waking you up during the night, if you have pets sleeping on your bed and you're tossing and turning because everybody's trying to get disentangled from each other, that's going to contribute to chronic sleep problems too.
Sure.
Right. So what it does is physiologically, it's a stressor. So essentially, poor sleep is chronic stress. One more element of stress on top of all the stress that we normally experience anyway. Right. So physiologically, it causes hypertension. It makes blood sugars worse because stress raises cortisol levels, which makes blood sugars worse. Stress suppresses the immune system, which increases risk of cancer. So rates of heart disease go up, diabetes gets worse, the complications of diabetes are worse. And then it's just the general mental fatigue that you just don't function properly during the day. So if you're tired during the day, you pay less attention. So if you're driving, you're going to have more of a problem during the day. And what happens is animals do this as well. We do what's called micronapping. It doesn't mean you're taking a nap. But if you're sitting at your desk and all of a sudden you lose 5 minutes,
right,
you just had a micro nap.
Okay.
So
we've been there. I've been there.
Right. We all do.
Sure. Yep.
We all have. And again, the more that you have that problem, if you have sleep apnea, that's a major cause of sleep disruption. Most people who have the sleep apnea don't even know they have it. Their partners in their beds know they have it, but they often don't. But what they experience then during the day is chronic sleep deprivation. Because their oxygen levels are dropping, the body goes into an alarm reaction, which again is a major stress reaction. they're not aware of it, but then they have problems at street lights. They fall asleep fall asleep at stoplights. I mean, they fall asleep at their desk when it's too quiet. So they'll have these periodic naps, mini naps, right?
Sure.
Without necessarily taking a nap or wanting to take a nap during the day. So the consequences of chronic poor sleep are huge, huge. Mental health disorders, anxiety, depression,
Sure.
all mental health disorders are made worse by sleep, if not caused by sleep. One of the other things that chronic poor sleep causes is an increase in the incidence of pain. There's clearly been studies done that have looked at poor sleep causing pain and pain causing poor sleep. So they actually go hand in glove in both directions. So poor sleep causes pain and increases pain. What happens is any pain in your body when you're sleeping, if you can't sleep, is amplified. Because it's quiet, your nervous system is quiet. Any signal that's going on in your body, whether it's the need to go to the bathroom, to pee, or to have a bowel movement, all that's amplified because the body has quieted down. And so you're picking up signals, sensory information from the body in a much more acute, more alarm type fashion than you would normally.
That makes sense.
Chronic pain causes poor sleep, and poor sleep causes chronic pain.
You're stuck in this cycle.
You're stuck in an absolute cycle.
You have the pain, it causes poor sleep, which causes more pain, which causes more poor sleep.
And the thing about the pain is not that the pain is you're not causing the pain. There's already a problem in the body that's related to the cause of the pain. You could have arthritis, you could have headaches, you could have
an injury
problems, injuries, recent wounds, etc. Any signal in the body that now the rest of the brain is quiet, you got this pain signal that's constantly tapping on you, then that's going to make you aware of it. Same thing happens with basically other mental health issues. If you're anxious already and you can't go to sleep, what happens? You become even more anxious because now the lack of sleep or the sense of lack of sleep is making you anxious because you're not sleeping properly. So again, another vicious cycle gets set up.
All right, let's talk about some solutions. So most people that I know at one point or another have sleep issues, and the stats that I've seen are off the charts. Over 50%, the majority of Americans, people have massive sleep issues. So, and there's a lot of ways, in addition to some of the things you talked about, to deal with it. And one are non-medication solutions. What do you recommend? What non-medication solutions do you frequently recommend to people who are coming to you?
I'm a medication phobe. I avoid medications unless it's an absolute last resort. And unfortunately, there are people for whom it's the only resort. And they themselves have decided it's the only resort. Mm-hmm. And usually that's usually a very anxious individual who becomes dependent on the medication, and they don't tolerate even 5 minutes of lack of sleep. So it's a huge anxiety issue. So you have to deal with the anxiety if you're going to deal with this problem, if there is a significant issue there. So the medication is to be avoided as much as possible, because one of the big problems with the medications for sleep is the increased risk of Alzheimer's.
Interesting. I was going to say you become reliant on it and almost addicted to it, but Alzheimer's as well. That's interesting.
Dependency is an important issue, but the most important issue, even one Ambien increases the lifetime risk of dementia.
Really?
So if you have people who are using Ambien on a regular basis, or alprazolam or Ativan or other medications like that, they clearly cause an increase. The research is clear on this. It causes a significant increased risk in dementia. Benadryl, which is a commonly used medication.
Sure.
Medication, right? Over the counter, but it's a medication. It's a commonly used medication and is also increasing the risk of Alzheimer's or dementia. Not to mention functional problems the next day, et cetera. So it can help you with sleep, but there's a trade-off. So what are some safe medications, safe supplements, or safe things that you can do to help you with sleep? Supplements for sure. And we mentioned melatonin. So melatonin is a common problem anyway for people who have a problem with sleep. And so you don't make enough melatonin, you don't sleep well enough. And the problem with melatonin for most people is that they use the wrong kind. There's two forms. There's a short-acting form and a long-acting form. The short-acting form, most melatonin is going to last 3 to 4 hours in the body. So if you use the short-acting form at bedtime, it's going to help you for about 3 or 4 hours.
Yeah, and then you're up again, and then you're anxious about that you're up again.
Exactly. The long-acting form won't help you to fall asleep as much. But because it's long-acting, it stays in your body longer, and therefore it's going to help you to stay asleep longer. And the biggest sleep problem is not people falling asleep. That's not the most common problem. The most common problem is staying asleep.
Right. You get up in the middle of the night, and then you're anxious that you can't sleep, and then that keeps you up. And then you
toss and turn, and you get into a vicious cycle.
Yeah. Yep.
So melatonin, and the problem with melatonin then is the dosing. So using the wrong form, if you're having a problem staying asleep, then you shouldn't use the short-acting form. You should use the long-acting form. If you're having a problem falling asleep and staying asleep, then use the short-acting form about an hour before you go to sleep, and then use the long-acting form at bedtime. They kind of move together. The blood levels begin to increase about the same time, and you pace yourself out so you sleep longer. Now, that's not a good solution for everybody, so it's worth trying. The next step is trying to find the right dose for yourself. There's all kinds of stuff about the risk of shutting down your body's own production of melatonin. We use high doses of melatonin in cancer, up to 21 milligrams at a time. The most common dose is about 3 milligrams. So everybody's got to kind of find their dose. And one of the common complaints about using melatonin is the hangover effect in the morning, or I'm too drowsy when I wake up in the morning. And my answer to people, you have to decide for yourself what you'd rather live with. Yeah, do you want the hangover, or do you want lack of sleep? You decide.
Does taking it earlier help? Like 2 hours before you go to sleep?
Well, again, it's going to help you to fall asleep. It's not going to keep you asleep.
In terms of the hangover, the hangover
again,
effect.
The hangover effect is much less with the lower dose taken at bedtime than it is with the extended release dose, because the extended release dose is going to last in the body a lot longer.
Okay.
And everybody's got different metabolic rates. Everybody has different rates of metabolizing the melatonin. So you kind of have to know your own body, find out what your right approach is.
That makes sense.
Right. So again, you may have to decrease the dose. And if that's the case, you're probably going to have to combine it with some other things.
So I know one of the things you specialize in, and we're going to talk about now, is another option that a lot of people don't know about, this pulse magnetic fields with helping with sleep. And I really want to delve into this because this is a powerful technology. So I'm going to spend some time going into this. I want to give out the website one more time for people to read about it. So if you don't have time, you're not listening right now, go to selfgrowth.com/sleep.html. So it's selfgrowth.com/sleep.html. It's all lowercase, but for now, I want to just jump in. So let's talk about pulse magnetic fields and what they have to do with sleep. So take us through it. So what is that, and what's the tie-in with sleep?
So pulsed electromagnetic fields are the safe magnetic fields. We all know about the environmental magnetic fields. We hear about this, EMFs.
Right.
How they're dangerous for you and they're bad for you and they do all these nasty things for you, especially now with the 5G coming in. But we're not talking about EMFs. We're talking about PEMFs, pulsed electromagnetic fields. EMFs are high frequency magnetic fields that get absorbed by the body and create harm to the body, just like a microwave oven.
Sure.
Okay? So PEMFs are extremely low frequency magnetic fields that have been used for over 50 years in Europe. They've now been used for about 60 or 70 years therapeutically. So they're designed to produce very low frequencies. And these low frequencies have different effects on the body. In the book, I outline about 25 different mechanisms of how PEMFs actually work in the body. And then I review with science, with 500 references, on how they can manage or help about 50 different health conditions. They can do a lot more than that, but that's the science, at least. So the PEMFs then are therapeutic, as opposed to being risky or harmful. Now, what happens with a PEMF, basically the body is irrelevant to a magnetic field. To a magnetic field, the body does not exist. It's like air. In a sense, it's like the wind blowing through the trees.
Right.
Goes right on through. The tree does not stop the air.
Right.
It can move things in the tree, but it's not going to stop it.
Yeah,
so magnetic fields like that. It goes right on through.
Right.
As it passes through, as these extremely low frequency magnetic fields pass through the body, they stimulate the production of energy in the tissues. That's called charge. So basically, it's electrical charge in the body. If that electrical The charge is then used by the body to initiate repair processes, to initiate rebalancing processes. One of the early things I found out about magnetic field therapy, PEMF therapy, is that it stimulates the acupuncture points and meridians. So you're not only doing tissue repair and tissue stimulation to do deep tissue healing and repair, you're also stimulating the acupuncture system. So you're doing a whole lot of different things with PEMFs. And again, I don't want to go into all the different mechanisms, although those mechanisms can relate to why PEMFs can help with sleep, because all the things that cause problems with sleep are, in a sense, to some extent, undone by magnetic fields.
Okay.
All right, so that's one aspect of it, is that helps to heal the body, helps to rebalance the tissue, helps to decrease pain. PEMFs have a natural pain-killing effect. They're almost equivalent to about 10 milligrams of morphine.
Interesting.
Just by doing the PEMF. Almost within minutes, you can reduce pain. Then in addition to that, you have all the other aspects of what magnetic fields do in the body. But we're using, so go ahead.
Can you step us through, so this pulse magnetic fields, so it's a device. Can you step us through, is it physical? Do you wear it? Do you keep it near you? What do you do? How does it work? And obviously it helps with a wide range of things. And sleep is obviously, we're talking about sleep, so it's a critical one right now, and also healing in general. So how does it work? What's the mechanics of it?
So essentially, the device I recommend the most commonly is a device called the Flex Pulse. And we have a separate website, flexpulse.com, and we have drpawluk.com, where you can read more information about this. But the Flex Pulse is a battery-operated, rechargeable, battery-operated, portable PEMF device. What you could do is got two coils that you plug in. They're two little pads, little square pads. Well, actually, they're more like pear-shaped pads. And you could put it on top of the pillow, inside the pillow cover, or you could put it under the top pillow. If you use two pillows, you put it under the top pillow, and then center it where your head would normally rest. And when you are going to sleep, you may hear a gentle clicking sound. That you know that the magnetic field is working. I call that audio magnetic entrainment. We'll talk about entrainment in a second. So the magnetic field then, with these little pads, can be run at maximum intensity all night long. And there's a frequency I recommend that it be used, and that's called delta. So that's program 1 on the Flex Pulse, the new G2 unit of the Flex Pulse. Program 1, or it's 3 hertz. 3 hertz is delta. So people who know about sleep know about delta. Delta being the most important phase of sleep. Not the most important, but it's certainly one of the most important phases, because that's when the most reparative work is done in the body. It happens about 2 to 3 hours, an hour and a half to 3 hours, an hour and a half to 2 hours into sleep, lasts for about an hour to an hour and a half. So if you get the first phase of sleep before you go into delta, and you get delta, that's the most important sleep for you to be getting.
That makes sense.
Delta then is designed, this system is designed to catch the brain waves, to stimulate the brain waves, so that they dip down into that delta region, so that more and more and more of the brain waves go down into delta. You can't put the whole brain into delta. That's impossible. That is impossible. It's called death, or near death.
You don't want that.
Right? You don't want that. So the brain has different parts of the brain have different frequencies that have to be working to do their jobs. So you have to be aware if you're going to have to go to the bathroom. You have to be aware enough that you have to go to the bathroom. So you don't want to suppress the brain so deep that you're not aware of anything.
Right.
That's not physiologically good for you, or balanced for you. So then with the brain entrained with the delta, it's like trying to sleep. Theta is like swimming on the surface of the water. So most of our night is spent in theta. So theta is when we first fall asleep, and 75% of nighttime is spent in theta. Part of that is called dreaming, or REM sleep, and part of it is called non-REM sleep. So delta is actually considered non-REM sleep, but it's a separate type of frequency. So it's very, very low frequency. So then the rest of the night you're spending in theta. When you're aware that you're not sleeping, you're aware of your dreams, you're in theta.
Okay.
The deeper in theta that you are, that like when your head hits the pillow and you're out, you're gone. You drop down into deeper theta. And then that slides you down into delta. So when you're aware and you're not sleeping, and now you're anxious and you're tossing and turning and so on, then you're up near the higher surfaces of theta. You're not awake, but you're not in beta either.
Mhm.
You're aware. So what we're trying to do then is to get those higher frequency theta levels down. So the metaphor that I use is that you're trying to swim on the surface of the water with a weight on your belt. So the delta is the weight. It's
Mhm.
dragging you down, so you're swimming just below the surface, or you're bobbing up and down, but you're going deeper. You're not right at the surface. You're bobbing up and down. So hopefully what you're doing then is you're going to spend a lot more of your nighttime sleep in deeper levels of theta or significant amounts of delta. And that's what you prepare to sleep.
That's the goal, because that's where your body's really healing. Now,
That's where your body is really healing, correct.
Now, when you wake up and your body kind of cycles and you wake up in the middle of the night, how does the pulse magnetic fields, what impact does that have? Is it more likely to keep you in a deeper sleep, or how does that impact the issue of people who fall asleep and they wake up and trying to get back to sleep?
Well, again, what you have to do on your own, you're going to have to allow your brain to settle down enough that you're going to slip back under that surface. You don't want to be at the surface. You want to be under that surface.
Okay.
So all the magnetic fields are doing is they're talking to your brain.
Mm-hmm.
So if you say, for example, if I whisper right now, you might hear me a little bit, but if there are other noises or distractions, you're not going to hear me well. But if I have a conversational sound tone with you, you're going to hear me. Now, if I start screaming at you, then you can't ignore it at all. You can't shut it out. Right?
Yep.
So depending on how loud I'm speaking, I have to pay more and more attention. Your brain will pay more attention.
Mm-hmm.
The brain's going to hear that and it's going to react to that sound. So all we're trying to do then with the PEMFs in a very gentle way is to coax the brain to be into a quieter state, so it can suppress the sound around you.
And you have that, and it's working with you throughout the night.
And it's working all night long.
All night long. So
it's a constant level all night long. I learned a long time ago there's something called audiovisual entrainment, where people use glasses and lights and sound to train their brains to go into meditation states. What I found is, through years of experience, is that the brain wants to be at a certain place. And there are many people who have these brain entrainment PEMF systems as well. So they start you at, let's say, beta, alertness. Then they bring you down to alpha, then they bring you down to theta, then they bring you down into delta. Well, it's trying to tell the brain what the brain should be doing. And the brain may or may not listen. So if you want to be in, let's say you were already very, very sleepy before you went to bed, and you got a machine that puts you back up into beta, you're going to have to go back down again.
Right. That makes sense.
Right. Now, if you're in delta and the machine says, wake up, and you want to stay in delta a little longer or theta a little longer because it's trying to ramp you back up again, well, then it's going to force you up where you don't want to be. So I've learned what happens is let the brain do it.
Mm-hmm.
I'm not so intelligent. I know exactly when I should step you down. So it's pre-designed, and you're going to have to just do what my machine tells you to do. So I figured out over time that the brain starts to listen to the sound. It doesn't happen like that. It gradually hears it, and more the brain starts to hear it and listen to it. And as you do that, you've coaxed more and more of the brain waves or parts of the brain to be gently oscillating or having that frequency, that low-level frequency. So it's a more gentle approach to coaxing sleep.
Right. All right. Makes sense. So you mentioned the term a few times. If you can spend a little bit more time on it, this concept of entrainment. So what exactly is it? Now delve a little bit deeper into how this all works together.
Well, the brain is like a tuner, like a radio tuner. So what happens in a radio tuner, you have the frequencies within the tuner.
Mm-hmm.
And so you have frequencies in the air. All these radio stations, all these TV stations that are in the air, they're broadcasting. Those signals are all in the air. They're all at different bands at different frequencies.
Mm-hmm.
And you change the frequencies within the tuner, and you hear a buzzing sound. You say, okay, now that's a station that I probably want.
Right.
As you dial it closer and closer and closer, then it gets louder and louder and clearer. Once you've locked it in, then the sound goes up significantly. It's audibly, you could tell the difference. Once it's locked in, that's called frequency following, and then that's entrainment. So you've entrained the brain now to listen. So our brains are the same way. We're like tuners. We can change our frequencies in our brains by the attention we pay.
Mm-hmm.
And so we could listen to this station or that station. We could listen to beta, alertness. We could listen to theta, relaxation. We could listen to alpha, relaxation, etc. So we are setting our brains to listen, to tune in to that particular frequency. Once we've tuned in perfectly, then we are entrained.
Okay, I get the concept. So one of the things you also talk about is this deep sleep technology, and DEEP's actually an acronym, D.E.E.P. So tell us a little bit about what exactly this deep sleep technology is. Well, first, what's the acronym, and how does it tie into this?
So D.E.E.P, obviously DEEP. So DEEP stands for Delta Enhanced Entrainment Program. So 3 Hertz is basically you're enhancing the brain's delta. You're training the brain and you're enhancing it with delta.
Mm-hmm.
So you're using delta to do the entrainment of the brain, to increase the amount of delta in the brain, which then helps you with sleep.
All right, and it helps your body heal and everything you've been talking about, basically. So this is the concept of the device and what the technology does. So how does this deep sleep flex pulse technology, and you've been talking about it a bit, you've already told us, but kind of a quick summary. So step us through again how this deep sleep, and you mentioned flex pulse technology works. So step us through it one more time.
So again, the idea is that if you're having issues with sleep, and you could pre-treat yourself before you even go to bed. You could set the flex pulse, has 10 different programs in it. So you could do a relaxation program before you, like 10 Hertz or 7 Hertz, before you actually go to bed. So you're already winding your brain down. So it doesn't have as far to go once you end up in bed. That's what we do is sleep hygiene. You shut down the sound, you shut down the stimulation, you do relaxation, take a deep bath, warm bath, etc. All these things that wind you down.
Right.
So the flex pulse then has the programs in it. You can pick these different programs, and the deep sleep program is the delta program. And all you do is turn it on, turn it up to maximum intensity, find the right place under your brain. Ideally, the best place to put it under the brain, which is not a practical place to put it, but the best place to put it is at the back of the neck, just at the top of the neck, just under the skull. The reason for that's called the reticular activating system. And the RAS controls consciousness.
Okay.
And alertness. So if you have the magnetic field the closest you can to that center that's in the lower part of the brain, pons and the medulla of the brain, then you're going to be able to grab the frequencies better at that level of the brain. So all the machine is doing is presenting the brain with a single frequency that's constant, it's not varying, and the brain starts to listen. And you are telling the brain, you're telling yourself, I'm going to listen to this frequency. And this is why the sound becomes a part of the treatment. The clicking sound that you'll hear, the 3 Hertz clicking sound you'll hear, is part of the entrainment process. And what happens is that people lay on it right over the coils. And in this case, you're going to lay on it probably basically under your face, on your side. You can't put it at the back of the neck, behind the ear. You can put it under the neck if you want to. You'll have to figure out for yourself where you want to put it. Most people end up just putting it on the pillow, under the pillow cover on the pillow.
Right.
Then you start to hear it and say, okay, now I'm going to fall asleep. So it's a self-hypnotic suggestion.
It's like
now
a
I'm going to
condition,
fall asleep.
and turns into a conditioned response.
Exactly.
So every time you start doing it, as you learn to do it, as soon as you start hearing it, it's going to trigger all the things that are going to help you sleep.
And you have to say to yourself, this sound, this clicking sound is good. It's part of the treatment. I need this sound. If you say this is an aggravation, well, what's it going to do? It's going to undo whatever you're trying to do with this system. We can't turn off the clicking sound because it doesn't work as well. The way the coils are designed is it does that clicking naturally. And what you do then is the clicking becomes a honing signal, a homing signal. So when your head rolls away from it, you've lost the auditory. And what happens then is if you become aware that you've lost the auditory, what do? You move your head back.
Move back.
It's a homing beacon. So it keeps you kind of, right over where you need to be.
All right. I want to give out the website one more time, because you delve in, you're talking about a lot of concepts, and you're going to delve into it a little bit more deeply on the website. So I want folks to jot this down again if you haven't gotten it. It's just selfgrowth.com/sleep.html. And you can also find a lot of stuff at Dr. Pawluk, just Dr. Pawluk, Pawluk.com. And we've talked a lot about sleep, and the focus was sleep, but I know this technology works in a lot of other areas, and you touched on some of them earlier. What else what's kind of some of the primary benefits of using this technology, this one main technology to help you?
So as I mentioned, there are at least 25 different mechanisms that are scientifically proven on what magnetic fields do, and at least 50 different diseases and conditions that it can help to manage. So even though you may purchase this for the sleep benefits, you can help other parts of the body. If you happen to have a foot or an ankle or a knee that's really bothering you, you can treat yourself during the day for that pain to help to relieve the pain and help to heal the tissue. So it does a lot of healing work. It's not just a pain reliever.
Right.
It's a healer. It's actually healing the tissues. It's giving the tissues the energy it needs to do the job that you want it to do. For example, pulse magnetic fields have been FDA approved to heal fractures that won't heal.
Interesting.
So some of these fractures could have not healed for 6 or 7 years. And that's a disaster. When you have a bone that won't heal, you can't use that bone. You can't use that extremity.
Yep.
Well, PEMFs have been found to start the healing process. So 12 hours a day of treating that area of the fracture, in a year, the fracture's healed. So why do magnetic fields do that when nothing else does? It's because they're stimulating all sorts of processes in the body, increasing stem cells, increasing energy in the tissues, increasing circulation, reducing inflammation, and again, it's initiating the healing response. I mentioned stem cells, a very important part of this.
Right.
So any other things that are going on in your body, this technology, while you're using it all night for sleep, you can use it the rest of the day for other problems.
I like it. So literally the same technology. Is it the same device that you'll be using for both?
Yes. It's got 10 different programs in it. And so program 3, for example, is 10 hertz, which is a program that's been found to stimulate stem cells.
Right.
Now, program 3 is alpha. So it's still going to relax you, but at the same time, it's going to have healing. So any of the frequencies in this system are going to help you for almost any other problems as well. Some will do better than others.
Very, very powerful. We're just about ready to wrap up. Any final words for the audience today? Any final message about specifically? Let's focus on sleep, magnetic fields. What would be your core message for folks to take away?
And if you've tried many other things and they're not working for you, so whatever you've tried and it's safe, like don't use the medications, or the medications are going to increase the risk of dementia. If some other things are working for you, fine. You don't need that. But you could still use the Flex Pulse for pain, arthritis, and other healing needs. If you find that they're not working, then if you have to add one more modality, I wouldn't necessarily stop what you had before, because it's probably working to some extent at least. So continue that. And magnetic fields work together with almost any other technology. In other words, A plus B equal, 1 plus 1 don't equal 2. 1 plus 1 can equal 5 or 10. So adding them to other treatments can be more effective. So adding them to CBD or medical marijuana or to melatonin or to PEA or other things that help with sleep, theanine, all of these together can, again, produce a stronger effect than any single one alone.
That makes sense. And I know a lot of people use and kind of swear by this technology. It's very, very powerful. So once again, make sure you check out the website, selfgrowth.com/sleep.html. Dr. Pawluk, thank you very much for joining us. This has been very informative, good information, great technology. Thanks for coming. And I'd like to thank everybody for listening. I wish everybody great sleep in your future and great success and a good year. We'll talk to everybody soon.
Thank you, everybody.
Bye-bye.